Good evening, I bid to all the lecturers and also the participants. We will wait for some participants for now. Sorry for the inconvenience. Assalamualaikum warahmatullahi wabarakatuh and a very good evening to the honorable lecturers, adjudicators, debaters from the government and opposition side, and not to forget the audiences. Ladies and gentlemen, welcome to the 6th annual Interbatch Debate Championship organized by the Diplomatic ESCO of Medical Student Association MESTA. On behalf of the organizing committee, we are pleased to welcome you. Before we start our debate championship for today, please kindly mute your speaker throughout the debate unless you are giving your speech or point of information P or I. Only the moderator and participating teams are allowed to turn on their camera throughout the debate. The juries are welcomed to turn on their cameras after the debate has finished to comment on the debate by the participating teams. Welcome to the third place match of the Interbatch Debate Championship. I am Nur Aina Nakia, the chairperson, and Aina Nasuha binti M. Ramni, the timekeeper for today. We are very delighted to announce our motion for today, which is this House believes that those with mental health disorder should not be accepted into medical school. I would like to introduce the debaters for today. On my right side, taking team is the team from Year 1, Uranus, with Mr. Muhammad Amir Haziq bin Johari as the first and third speaker, Mr. Muhammad Adib Luqman bin Khairul Azman as the second speaker. On my left side, taking the role as the opposition team, is the team from Year 2, Mars, with Mr. Muhammad Iqbal Hakimi bin Luqman as the first speaker, Ms. Aisha binti Abdul Halim as the second speaker, Ms. Nur Ain Sabrina bin Abdul Nasir as the third speaker, and Ms. Shazwina Adrina binti Muhammad Hisham Sullah as the reserved speaker. There are three adjudicators who will adjudicate this competition. The first jury is Dr. Mark Tan Kiak Min. The second jury is Dr. Wan Norafika Othman. The third jury is Dr. Ruzi Hamimi Razali. Now, I would like to state the rules and regulations for today's debate. The time allocated for the first speaker of the government team is 7 minutes. The timekeeper will ring the bell once. At the first minute, which signals that point of information P or I are allowed to be given from the opposing team. The bell will be ringing again at the 6 minutes to signal the end of chances for P or I to be given. The timekeeper will ring the bell twice at the end of the 7 minutes, indicating that the time is up for the speaker and the speaker should do his or her closing speech immediately. Any POI given before the first or after the 6 minutes should be ignored. Please do keep in mind that an extra 1 minute is given for the speaker if the speaker has a poor internet connection during the speech, which the timekeeper will take into account the extra time. For the rest of the speakers, the time allocated for them to deliver their speech is 6 minutes. The bell will be ringing once at the first and the fifth minute to signal the duration for POI can only be delivered. Any POI given before the first or after the fifth minute should be ignored. The timekeeper will ring the bell twice at the end of the 6 minutes to indicate the end of the time for the speakers to deliver their speech. And they should do their closing speech immediately. The speakers will be penalized if the time taken exceeds the allocated time. Again, an extra 1 minute is given for the speaker if the speaker has a poor internet connection during the speech, which the timekeeper will take into account the extra time. Next, I will briefly declare the roles of the debaters. The first speakers of the government and opposition team need to define the motion and state their stand as well as introducing an idea or more to support or against the motion. The first speaker from the opposition also needs to rebut the idea given by the first speaker of the government team. The second speakers from the government and opposition team need to convey two or more ideas to support or oppose today's motion. In addition, the second speaker of the government team needs to rebut the idea given by the first speaker of the opposition, while the second speaker of the opposition team needs to rebut the ideas given by the second speaker of the government team. The third speakers need not to introduce any ideas and need to rebut all the ideas given by the first, second, and third speakers of the other team. For the reply speech, the time allocated to prepare is 2 minutes, whereas to present the reply speech is 3 minutes. The first or second speaker of the opposition team should present his or her reply speech first, followed by the first or second speaker from the government team. The speakers cannot introduce new ideas and will need to summarize their arguments and reaffirm their stand regarding today's motion. The third speakers are not allowed to present the reply speech. The timekeeper will be ringing once at the second minute as a last minute warning and will ring the bell twice to signal the end of the debate. Are the participants clear of the rules and regulations? Okay, thank you all. As the rules and regulations are fully understood, I would like to call upon the first speaker of the government team, Mr. Muhammad Amir Haziq bin Johari, to deliver his speech.
Thank you so much, Chairperson. Assalamualaikum warahmatullahi wabarakatuh, and a very good evening to I bid to the panel of juries, to the opposition team, and to the audiences that are watching us debating tonight. So tonight we have a pretty interesting motion up for debate, which is this House believes those with medical health disorder should not be accepted into medical school. And we, as the side of the government, fully agrees with this motion, which is we are not accepting people with mental health disorders to become medical students in medical school. So let me define the motion properly. So medical health disorder in this case is anything that which severely limits one's control over their mood, thinking, and behavior. And accepted into medical school means enrolled into medical programs in any kinds of medical institutions. So the burden of proof that have to be proven by us is that severe mental health disorders that negatively affect students' capabilities to learn and apply knowledge and doctors' capabilities to treat patients later on. And the burden of proof that needs to be proven by the opposition team is that why we should let these students that suffer from mental health disorders get into medical school. So I would also like to completely tell you that we are okay with not accepting people who have been fully diagnosed with mental health disorders into med school. What we are not okay is that simply letting anyone who might have mental health disorders who are not diagnosed but could pose a risk to other people into med school. Uh, my first point as the first speaker is the optimal condition for learning. So we from the government side believes that the student needs the optimal condition to learn. And these conditions could be explained in three terms, which is the environment where the student is studying, the state of mind, and the physical health. And in today's debate, we want to specify, we want to be more specific to these conditions, and we want to focus on the state of mind. So, the state of mind. Now the government side wants to specify. Like, again, the government side wants to specify, as per given by the motion, the best condition that we believe should be optimal in the state of mind. So the state of mind, as per defined by our side, is what determines the mood, the thinking, and the behavior, as per mentioned from the definition of emotion. So again, the mood affects whether students are feeling well enough to study, to attend lectures, and to attend lectures. Essentially, we believe that people with MHDs, medical health, mental health disorders, um, will be more prone to having their mood be disrupted. For severe cases like depression, their mood can plummet greatly, and this could significantly affect their performance. I'm so sorry. To specify the mental health disorders that we want to elaborate more on this debate, the kinds of mental health disorders that are severe, that could that are severe, but we there are severe like depression, like anxiety, that could risk the student's life and also people around them. So again, behavior, as I was saying, the state of mind is determined by mood, thinking, and behavior. So continuing with behavior, behavior affects how students act, and we also believe that people with MHD, mental health disorders, could have worrying behavior that could affect not only them but people around them that are trying to learn in these medical institutions. So behavior could essentially be explained as actions that are taken by these mentally unhealthy students, mentally unhealthy persons. And these actions could jeopardize their well-being, and this could lead to them skipping meals and staying up late, which are the symptoms of mental health disorders like eating disorders like bulimia and anorexia, and also in people with ADHD.
Here I
Sorry. Basically, we believe that by letting students that have mental health disorder get into medical institutions, medical programs, it could basically inflict harm to the student themselves. Because by letting these students get into medical programs, they will be exposed to more burden, uh, more than unneeded. We all know, we all are well exposed. We are all um, uh, we are all well exposed to the idea that medical school is very hard. The syllabus is very hard. The long hours of studying, the long years of period of learning by itself would affect the mental stability of someone who is mentally healthy. And we, as the government, wants to limit the applications of people with MHDs, mental health disorders, to ensure that these people are not burdened by these pressures. because there are multiple cases of people with students who are pressured and could go to extremities. So basically, we, the government side, believe that by not accepting not accepting people that have diagnosed mental health disorders could just bring more good than harm to them and to people around them. Uh, um, I think that's all from me. Thank you.
Okay, thank you so much to the first speaker of the government team. Now I would like to call upon the first speaker of the opposition team to deliver his speech.
Can you hear me? Okay.
Yes, loud and clear.
All right. Ladies and gentlemen, the motion today is this House giving a few arguments under our side to show you why why we actually should accept these people that have mental health disorders, and I will be talking about that much more further later. But firstly, let's go towards the rebuttals of the Prime Minister and the side government. Firstly, regarding the definition, they mentioned about how fully diagnosed people can enter these medical schools, and yet those that aren't fully diagnosed, they aren't able to enter. They cannot enter these. They cannot be accepted into this medical school site. We think that this type of mechanism is actually very vague, or also very like you haven't given us like a too clear mechanism to show you how you can actually fully diagnose, how you can actually determine whether that person is fully diagnosed or not. And we'll tell you about this much more further in my largely, we accept the definition of mental health disorders being the ones that severely limit the mood, behavior, and thinking. We specifically think, however, that people that severely have clouded judgment and cannot function as doctors in the future, this does not count in our debate right now, because we think that no matter how much we debate it, if they aren't able to function as good doctors, then they shouldn't be doctors. These include patients that are, in Malay, they call that as tak sempurna akal. These people, we do not count in it does not count in our debate today. The rest, however, such as what government says, anxiety, depression, adding to that bipolar disorder, OCD, for example, all of this counts in our motion, in our debate today. So first point under side government regarding optimal condition for learning. Yeah, sure.
I think you misheard from what my first speaker has said. He said it was okay with diagnosed. We are okay with not accepting diagnosed people, but we are not okay accepting undiagnosed people. You got it backwards.
Okay, so therefore there's no confusion in both of our sides. Okay, so going to my first point, my rebuttal to your first argument, which is optimal condition for learning. He mentioned about how the state of mind is what determines the mood, thinking, and behavior. And they mentioned that these people that have mental health disorders, they are more prone for mood to be disrupted and has worrying behavior. And this affects the people around them that are trying to learn. We think that the government is being stereotypical in thinking that these people that have mental health disorders, they will inevitably affect the people around them that are trying to learn and will cause discomfort or cause displeasure towards these students, towards their medical friends and all of that, right? Secondly, they mentioned about how these patients will be having trouble with skipping meals. They will have jeopardized their sleep. First of all, we tell you that we as healthy medical students, we also suffer the same problem. And yet, we also tell you that there are management that can be done, which will further be elaborated in my argument, that can help these people with mental health disorders in order to them to be able to be function well in the medical school. So going to my argument, firstly, under the keyword of it, the act of accepting the act of not accepting these people is actually an unnecessary action. Firstly, why is that so? Is because firstly, mental health disorder, we tell you, is a manageable disease, because as long as they are compliant to its medicine, it will not actually affect the judgment, the work rate, etc. of these medical students. And even in the official guideline from the MMC in 2010, they have already closely monitored if there is any impairment. What they do is that they closely monitor in case if these medical students or future doctors have impairment in the terms of their work. And if they believe that if there is a belief that they are being impaired, then what they do is they report and then they assess these patients, assess these students, and then they make the recommended action. But that does not mean that we are rejecting them from going into medical school. But it is not decided solely based on their medical condition, but they also include, for example, the compliance to the treatment and the follow-up, physical and cognitive impairment, and specifically skills in relation to his professional practice, which my second speaker will further elaborate, and insight into his condition. So only then, when they have assessed all of this, will it be determined to either to suspend the patient, to suspend the student, to restrict the student, or to even make any other recommendations. Not just wholeheartedly just denying these patients, these students, from being accepted into medical schools. And even if they are not compliant to medicine, they can actually still be managed. For example, we can do counseling for bipolar disorders, psychotherapy treatment. In our context, mental mentee can actually help alleviate these people from being through stress, such as what the Prime Minister has mentioned. Is there is no definitive diagnosis, because how are mental health disorders diagnosed? Doctors look at your experience, your symptoms, your behaviors. How long have you been experiencing these things? The impact that it's having on your life. In order to do this, what they do is they ask questions about your mood, your thoughts and behavior, and sometimes they use questionnaires and forms. And then they base the diagnosis in what you describe. Do we tell you that this isn't actually definitive? And it requires your participation, firstly because it requires your participation and you have to answer them truthfully. Therefore, with the effect that you put by rejecting these students with mental health disorders from being into medical school, then they might not be accurate, they might lie and all of that. This will be talked more by my second speaker. And also, it bases on the scale that are different from everybody. So it's not as accurate as there are no physical tests. And for example, you check the blood. For example, in physical tests, you check the blood and then you can confirm you have a disorder. Right? But you can't do that with mental health diseases, and a series of tests is not definitive. This effect causes misdiagnosis, which will cause rejection of and accepting people that are possibly aren't. Either way, we show you this is unnecessary. And thirdly is regarding like normal medical students that can still get mental health disorder after admission, because what you mentioned, how they're stressed and all of that, and they can also, even if you take out these mental health disorder people from being into school, when you put normal people in, they have a much more higher capacity to getting mental health disorders. And therefore, we tell you that the same thing will also happen under your case. Ladies and gentlemen, consider medical school. We tell you that mental health disorders is not the only thing that side government claims will affect our decision making, etc. We tell you that normal type of things actually can do the same thing. Therefore, you shouldn't actually just focus. You shouldn't just say that mental health disorders of patients should not be accepted in medical schools. Please.
Thank you to the first speaker of the opposition team. Now I would like to call upon the second speaker of the government team to deliver his speech.
Ladies and gentlemen, I would like to start my speech with a few rebuttals from side government. Now, I'd like to start by addressing one point made by the first speaker of side opposition, in which in which he states that normal students are also prone to suffering these problems, and it's not and it's not specific to mental health, students with mental health disorders. We argue that as my first speaker has said, we argue that yes, normal students may also suffer through these problems as well, but and also may develop certain qualities of mental health disorders. However, we argue that even if that, first of all, these things don't even if they did even if normal students develop these mental health disorders, we argue that they are not as frequent as if this were to as frequent if this occurs to students with mental health disorders, and also it's not as severe. We argue what we stress very much, as what my first speaker has said, is severity. As my first speaker has said, our medical program is stressful. It demands a lot from its students. How would you think that these students with mental health disorders would fare if you were to subject them to these environments? You argue because comparing normal students and mental health students is not fair. They have a specific disability regarding themselves, and we are not trying to stereotype mental health disorders and seeing them as incompetent. We are trying to mitigate. We're trying to avoid the problem. Sorry, I'm not accepting POIs. We are trying to mitigate the problem of them going through these pains. We don't want them to go through these pains. And also, lastly, I want to rebut on not accepting them is unnecessary. They argue on that it's a manageable disease, that it can be managed through counseling or medications, and that it's not a definite diagnosis. We believe that though it is a manageable disease, it will not be managed enough to the point where they can be competent in their field of study or competent in their career of choice. They highlighted the fact that they are assessed, that there are studies that they are assessing these students based on their skills and their commitment. We argue that this is unnecessary because the fact of the matter is, no matter how much you assess them, no matter how much you try to counsel them, there's always that fact that they don't possess the qualities that my first speaker has said: mood, behavior, thinking. These things, even though they may get some of them back, we argue that it's not enough. And also they argue on the fact that it's not definite diagnosis. There are a lot of gray areas. We strongly agree with that. Of course, there are lots of gray areas. However, there's a reason why we diagnose it in the first place. We diagnose it in the first place so that we know what to expect coming from these individuals. And without diagnosis, how are we supposed to know what's wrong with them? So that's the end for my rebuttals. Now I would move on to my one argument on the treatment of patients. Even if by the miracle of God that these students did manage to go through all of this, to go through what my first speaker and their first speaker has said, I've gone through medical school, gone through passed every exam, I've graduated, alhamdulillah, all that good stuff, right? Now they are on the career to becoming a doctor. Why is it that even when after they graduate, it's still a bad idea? So my argument is on the treatment of patients. First of all, in the treatment of patients, it needs knowledge and a good state of mind. Now they already have the knowledge, as we've already established. I'm sorry, I'm not accepting POIs. So knowledge is covered, but as I said before, state of mind is still compromised. Now it's important there are various aspects of a doctor that is important, which is, first of all, information, differential, and diagnosis. Now, in the aspect of information, it is important for a doctor to collect information from patients, and this requires behavior and social interaction skills from the doctor. Without it, insufficient information can be extracted from the patient, when there's less information, there is less quality treatment. We believe that these individuals lack these skills. No matter how much you do to them, they lack these skills, and they may not extract enough information for a diagnosis to be had. And finally, on differential diagnosis, there is this discussion. There will be in differentials. There will be a discussion with others to come up with a diagnosis, and this also requires behavior skills, thinking, and so what will happen is these students, they will suffer from a lack of focus. They will suffer from, and with a lack of focus, they will have they will offer less. They will contribute less to the discussion, and less fruitful discussions means that others need to compensate for them, which doesn't necessarily reduce the quality of treatment, but they certainly don't contribute much to the discussion. Now, with all that said, we believe that these doctors who were suffering from mental health disorders from when they were students would then go on to suffer as well in their careers. So we argue, why enter the medical field in the first place? And with that, I highly propose. Here.
Am I clear?
Sorry, everyone. The moderator is having a bit of internet problem. So let's proceed to the second speaker. Sorry for the interrupt. Sorry for the problem.
Am I visible and audible? Assalamualaikum. Thank you, Mr. Speaker. A very good evening. I would like to wish to the honorable adjudicators, precise timekeepers, fellow members of the opposition team, the government team, and members of the floor. We from the opposition team strongly believe that those with mental health disorders should be accepted into medical school. I am Aisha Abdul Halim. As the second speaker of the opposition team, I will start with rebutting the government side of the opposition. First of all, you had an attempt to persuade the floor that allowing someone who is fully diagnosed but not allowing someone who is not. We think that how are you going to screen each and every candidate? It is not easy. It is not an easy process to be diagnosed. It is not a definitive process. Plus, a psychiatric visit is not as cheap as you think it is, and not everyone is able to afford a session. That doesn't add up with candidates who choose to disclose their information. Secondly, you're saying that passing medical schools with mental health disease. So let's say if you had graduated, it means that you are very much capable. Secondly, there are guidelines that are available. It's jeopardizing a patient. Furthermore, Malaysian Medical Association has recently launched an initiative called Help Doc, which is a support group targeted towards doctors who are dealing with work pressures and personal problems, which negates your whole point totally. Without further ado, let's come to my first argument. We as the opposition side disagree with this motion tonight, as we believe that giving an opportunity for those with mental health disorder will open the borders and fight against the stigma of mental health in our community. According to Mental Health Foundation, 9 out of 10, sorry, I'm just starting my point later. Nearly 9 out of 10 people with mental health problems say that stigma and discrimination have negative effect on their lives. What you had just mentioned is just creating more stigmatization. You as the government team, if you close the borders, you're basically allowing more people with mental health disorder to disclose their problems, and as you are stigmatizing, leading to much more detrimental outcomes. As my first speaker had mentioned, there is no definite diagnosis to be done. This will then allow loopholes, as a lot of candidates can lie in their application. In order to avoid that, the opposition team allowed them into medical with the correct guidelines, as my first speaker had mentioned before as well. It caters to the problem that you might have created, and it is much logical to be done. Other than that, medical students are more susceptible to mental health problems. And it is proven under study done by UPM that 63% of medical students have anxiety, depression, and stress. There's no point in rejecting medical students with mental health issues. It is now time to change how the community think and acts. Furthermore, as medical institution, you are not supposed to put these people aside. It is just as if you are worsening the stigma. How are people going to come to you for treatment if you cannot accept these people with mental health issues? Yes, I. Okay, never mind. Moving on to my next point. We should allow students with mental health problems to be accepted into medical students in order to not disregard their potential. Recruiting medical students is mainly based on their credibility. You cannot disregard someone who is credible just because of an illness, knowing that they are very capable. One journal that is written by our own faculty entitled Fitness to Practice for Doctors and Medical Students with Mental Health Issues in Malaysia, and it is well acknowledged by the medical world. It stated a case in the UK that a doctor with bipolar committed suicide due to them stopping her from practicing. Today, we are emphasizing that we should treat every candidate equally. Let me illustrate my point with a simple analogy. Imagine a candidate with diabetes. You are going to treat someone with diabetes just the same as any other candidate that applies for medical school. Therefore, why are you, the government side, is giving an indifferent treatment towards someone with mental health disorders? Yes?
Diabetes is not a mental health disorder.
It is an illness. I'm saying here, mental health is an illness. Why are you treating someone with mental health disorders as something that is different? It is just the same as any other disorder. And you can manage it as well. So back to my point. You are now giving stigmatization and much more detrimental causes to the future outcome. And we, as the opposition side, we do not give any added benefit, prioritization, or setback to those with mental health issues, giving them a fair fight so that they can enter medical students fairly and with their credibility. In conclusion, we from the opposition team had showed you a clear view in which you can see that candidates with mental health disorders should not be put aside and allowed to be accepted into medical schools. That's my case.
Thank you to the second speaker of the opposition team. Now I'd like to call upon the third speaker of the government team to deliver his speech.
Hello everyone, I'm back. So basically, I'm going to just tell you what we're trying to talk about, what we're trying to convince you about, what we're trying to talk to you about. So basically, we from the government team decided that we don't want to accept students who suffer from mental health disorders into medical programs, because we believe that by accepting them into these medical programs, it will do more harm than good to them, to people around them, and to patients that they'll be dealing with in the future overall. So, as mentioned by myself, because I'm the third speaker, as mentioned by myself, the optimal learning environment, we believe that the optimal learning environment consists of the state of mind, specifically in this motion, behavior, mood, and thinking. We believe that these three conditions could be worsened, could not be on the best level if within people that have mental health disorders. And from the opposition team, the second opposition stated that, what would happen if we diagnose everyone? What would happen if we screen everyone and we determine who are diagnosed and who are not diagnosed? Will it arise discrimination? Basically, what they're trying to say is there's going to be discrimination against people who are diagnosed with MHDs and overall this will lead to stigma. This will lead to even ever-growing stigma in our society. But the thing is, screening. They're trying to convince the floor that by being diagnosed, by being screened, you are telling everyone about your mental health disorder. But that's not the case. We all know that these screening tests, because even before you become medical students, you have to go through screening tests by itself. We all know before becoming medical students, we need to go through the physical part of screening tests, like blood taking, like taking your height, taking your weight, all that. What we are trying to say from the government side is that we just want to include the screening test. We just want to make sure that before you get into med school, you need to make sure whether you have medical health diagnosis or not. If you have medical health diagnosis, then you're not going to get accepted, because to us, a diagnosis means that you are not eligible. You are not resilient. Sorry, you're not resilient enough to go through the burden, the pressure that that you have to go through when you become a medical student, as per mentioned by myself during first speech before. And also, talking about the screening test, the Malaysian Medical Association also proposed prospective students seeking further their studies in medicine to be subjected to screening tests. And the president of MMA, Dr. Koh Kar Chai, also stated that they, from the side of MMA, believe that anyone, it actually justifies what we're trying to say, which is anyone who wants to get into medical programs need to go through screening tests that not only diagnose their physical health, but their suitability in terms of their mental health, to ensure that they don't get pressured by the burdens of the studies. So the second speaker of the opposition team also mentioned that if you graduate from medical school, that means you are capable. I think that's a very, very, not ignorant. I'm not going to say you're ignorant. That is a very not too strong of a point, because you are basically summarizing everyone in the same pool, meaning that if you get all A's, then you are capable to become competent doctors. If you get all C's, you are also going to become competent doctors. Yeah, you may graduate. Yeah, you may be able to become doctors in the future, but will you be able to become competent doctors in the future? We, from the government side, believe that people that have mental health disorders will have the issues of not being able to, like I said earlier, become competent doctors due to not being able to reinforce their positive mood, their positive behavior, and their positive way of thinking. Also, that is the medical student part of the argument. What was mentioned by the second speaker from the government team, which is the treatment of patients. Yeah, like was mentioned by the second speaker of the opposition team. They may graduate, but will they be able to treat patients with competency? Will they be able to treat patients not? You may imagine you have to treat patients, but you also have to solely focus on yourself. You know what I mean? Like these, we basically what we're trying to do. The government side, we care about our students. We care about people that are trying to become medical students. We know how hard it is to become. We know how hard of a journey it is as medical students. We want to limit the placements to those who we believe are capable. So by limiting the placements to people who do not suffer from MHDs, we can totally make sure that the people that goes through this long process, the people that goes through this this hard syllabus, they are pressured, like was mentioned by my second speaker. They are pressured, but they are not too pressured. You know what I mean? Before they become by making sure that they are diagnosed before they get into medical school, by making sure they are diagnosed before making into medical school, we are ensuring that we can put enough pressure to those who can handle it.
Okay, third speaker, please finish your sentence, please.
Yeah, thank you for reminding me. With that, I think I will, I think that's all from me. Thank you.
Okay, thank you so much to the third speaker of the government team. Now I would like to call upon the third speaker of the opposition team to deliver a speech.
Assalamualaikum. Am I clear? I'm sorry because my internet connection right now is like kind of unstable. If I am not clear or if I am cut off, just I don't know how you let me know, but just at some time or something. I'm sorry. So wait, 1, 2, and 3. Assalamualaikum and good evening, respected chairperson, our honorable members of adjudicators, accurate timekeeper, worthy government team, and reassuring members of the opposition. My name is Sabrina, and as the third speaker of the opposition team, I will rebut all of the points given by the government. We, the opposition team, firmly disagree with today's motion that this House believes that those with mental health disorders should not be accepted into medical school. I would like to start my rebuttal for the first speaker's point. Even though his mechanism is not so clear, but I'll try to attempt and rebut whatever he said just now. So basically, the first speaker attempted to convince our audience that all people with mental health disorders have impaired mood, thinking, and behavior all of the time. He put it like all of the time. And we, the normal people, like people without mental health disorder, always have good moods, have great thinking and behavior skills. Like it doesn't make sense. It doesn't make sense at all. It is like kind of like ridiculous to claim something like that. And also, it is very much incorrect. And it is proven that, like my first speaker said, we can treat them. It is something very much treatable. It is not something that is meant death sentence for the patient who are being diagnosed with mental disorders. Sorry. So the next one is the first speaker failed to define the severity. What does he mean by severity of mental health? He is always saying that it is severe, but he never defined what the severe means. It is very much hard for you to even put that patient is like, oh, that this person has mental illness, because it is very much subjective, because the person themselves need to disclose how they feel. For example, even if I ask you right now, how do you feel from scale 1 to 5? Are you the happiest for 5 and the saddest for 1? Where would you put? You, even yourself, will be very hard to explain how you feel at current moment, and you expect people to like easily diagnose the severity of the mental health disorder. And also, they are talking about inhibiting this student will not have the ability to treat patients. We have 5 years. This is the preparation time. If by the end of 5 years they are not capable, they are not fit to become a doctor, the opposition team, we agree that they should not be a doctor. Like my first speaker already stated, if they cannot become a doctor by the end of the 5 years, sure, we are not saying that, oh, they should still become a doctor, not a safe doctor, because we are not never said that. We are saying that to admit a student with mental health disorder who are going through treatment, it is okay. If it is under manageable, because it is very much manageable. If it is manageable, then they are normal like any of us, because like depression, anxiety, we all have gone through anxiety. So you cannot tag like people with anxiety disorder, oh, they cannot be an excellent student. Next, going to the second speaker of the government team, he only gave 1 point where he tried to persuade, saying that students with mental health disorders, when they become doctors, they will give less quality of treatments, and there are lack of skills to treat. And also, he put it in a way that as if people with mental health illness are dumb, because he said that they are not capable of diagnosing patients. Unfortunately, What I would like to say is that from National Alliance of Mental Illness, the statistic has shown that people who are smart
TOI.
attended, wait for a minute, let me finish my sentence, have higher tendencies to have mental health illness compared who are not in the mainstream field. Yeah, continue with your POI, sir.
I never said that these doctors are dumb. I said quite the opposite. I said they had knowledge. What I am trying to say is that
Wait, the third
what I'm trying to
speakers-
say is that they don't have the capabilities of discussion.
Oh, they are not capable of discussion. What does that mean? They are dumb. They cannot communicate. They cannot talk. How? What does that mean? Cannot discuss? Cannot discuss in what sense? I don't get. Cannot discuss. What? People with depression, they cannot talk. People with anxiety disorder, they cannot discuss with professionally. They can discuss if they are treated well. They can discuss. We are saying that people, if they get proper treatment, they are very much like any of us, they are very much normal with proper treatment and care. Moving on with my point is that it is not easy for you to even screen people like this. And you are asking, before this, you are saying that, oh, we don't want to accept people who are diagnosed with mental health issues. And then your third speaker said, oh, we should screen every student before. It is a new point, and you are not allowed to put any additional new points. So it is already wrong in sense of debate. For example, if patient who have other chronic illness, for example, if doctors have other chronic illness that require dialysis, which needs more maintenance compared to mental health illness, are you going to say that, oh, this doctor need to take care of themselves more, so they are incapable of taking care of their patients? Because that is what your third speaker said just now. You cannot take care of yourself because 100% you need to take care of the patients. Yourself doesn't matter at all. So, ladies and gentlemen, throughout the course of this debate, we have proven and demonstrated over and over that this is very much slanted and even narrow-minded to prohibit medical students with mental health disorder from pursuing medicine, because we are all humans and we are not immune to mental health illness. As my first speaker said, mental health disorders is just like any diseases. It can very much be treated and managed. And with proper treatment like antipsychotics and antidepressants, we are very, very much can make them live a normal life. And my second speaker have already also discussed about stigma. If you prohibit students from entering medical school, you will increase the stigma towards people who have mental health illness and prevent them from seeking medical attentions. Lastly, we mainly judge students by their credibility, not by their illnesses. So, Mr. Chairman, distinguished guests and members of the floor, for these past minutes, I've already stated and given elaborations of the point under the side opposition, which we should let students with mental health disorder to enroll medical school. With that, thank you.
Okay, thank you so much to the third speaker of the opposition team. As the debate is reaching its end, I would like to allocate 2 minutes for this first or second speaker from both teams to prepare their reply speech. the first or second speaker from the opposition team, please present your reply speech.
Can you hear me? Ladies and gentlemen, Mr. Speaker of the Hall, a few problems under side government that I want to highlight in my speech today. Firstly, side opposition tells you that side government's mechanism is very flawed. First, they say that those that only have the diagnosis of mental health disorder cannot enter the medical school, and those that are already screened and then they don't have the mental health disorder, they are able to enter. The thing is that with the mechanism, under the mechanism, no one is actually going to come out and get the diagnosis of mental health disorder, because I've already mentioned to you in my point that this isn't a definitive diagnosis, and that you are able to lie in order for you to be able to get into the medical school. Because they're scared of not being able to get into the medical school, and therefore they aren't going to help in terms of the diagnosis, and therefore under side government, the problem will still stay the same. Secondly, we tell you that side government is gatekeeping medical schools from people with mental health disorders. They argue that people with mental health disorders is essentially helpless. First speaker mentioned to you that they actually are going to have worrying behavior. Second speaker tells you that they will lack the skills in becoming a doctor. This in itself is very flawed, because if they're already being able to become a doctor, they're already able to go through the 5 years in being in medical school in order for you to pass to become a doctor, then we tell you that this is already proof that they are well able and that they are able to treat the patients, and they have the certain skills that is needed to treat patients in the future. In fact, we tell you that this motion is about medical schools, and therefore it isn't really about that, but I digress. So next, under side opposition, we think that people with mental health disorder also deserves the chance to become this noble occupation of being a doctor. We argue that they are actually capable to be allowed to enter into the medical school, and we are able to use what help tackle the stigma that side government believes. Now, let's compare. Under side government, they say that people with mental health disorder cannot become good doctors. The reasoning is because they cannot focus on studies and they lack the skills in becoming a good doctor. Under side opposition, we tell you that with the proper treatment, then they are able to study, and if they manage to become good doctors after 5 years of medical schools, then we tell you that means that they are actually capable. Now, let's, for example, compare with the patient with diabetes. Entertain me for a second. Logically, they still cannot focus in study problems. They have fatigue, they have headaches, etc. And
Hello?
I'm already almost done. I'm already done with my points, and therefore go with side opposition. Thank you very much.
Okay. Please mute your. Okay, thank you. Okay, thank you so much to this first speaker. Now the government team.
Ladies and gentlemen, there is an important distinction that must be made in this debate, and that is between normal people and people with mental health disorders. Side opposition will come up here and try to argue to the moon on how mental health people with mental health disorders don't suffer through that much pain. Mental disorders, people who go through these mental disorders don't suffer as much burden, or rather they don't suffer. They suffer the same amount of burden, they would argue, as normal people. We believe that it is a very unfair assumption. We believe that is a very harming assumption, because what you be saying is that these people with serious problems can just be waved with the hand and say, you just be counseled, just be treated with medications, and you'll be fine. We believe that this liberalization is dangerous. Now they also have made the assumption that, now I would like to find a few flaws as well on their side. They have made the assumption that medical schools are the same as regular hospitals. In which case, I ask you, have you ever listened to what housemen who graduated from medical school have said about hospitals? They would say it's a nightmare. They would say that their bosses are a nightmare. They would say that everything about it is a nightmare. Do you think that these mental people with mental health disorders can be able to cope with that? Which was what I was trying to argue in my speech as a second speaker. What side government is always have been trying to prove is that there is a distinct difference between normal people and mental people with mental disorders, something which for some reason can't go through the heads of opposition. Normal people can go through the program and have a good career. They are capable, they are resilient enough to go through this harsh syllabus and still make it out okay in the end and maybe have a good career. This simply does not apply for people with mental disorders. As said before, they simply lack certain capabilities that normal people have. And this is not stereotype. This is a statement of fact, as said by first and third speaker, and that is the same person, that these things need to be screened, that these things need to be written down. What we are not trying to say is that we're not trying to say that these mental health people with mental health disorders are incapable. We're just saying that within this field, it is just out of their league. We are very sorry to those aspiring doctors, to those aspiring physicians who have mental disorders. They want to become a doctor, but we just can't accept them because they are simply not capable. To end, I would like to point out one more flaw from opposition. They talk about stigma and how gatekeeping people with mental disorders from medical programs would further the stigma. I would like to ask them, what would happen, let's say, if someone with a mental health disorder were to inflict harm on another patient without and of course unintentional? What would that do to their reputation? Is why I asked to set a position. And with that, I proudly propose. Here.
Okay, thank you so much for all the debaters. Now we'll give some time for adjudicators to carefully give marks and discuss who is the winner of today's debate, as well as deciding the best speaker. The jury will judge the debate only based on the points argued by the speakers and not their personal opinion of the motion. The juries will now enter the breakout room to have a moment among themselves. Thank you all for the cooperation. Now we would like to ask the juries to comment on the debate that had happened. So we start with Dr. Mark. Can you comment on the debate that had happened?
Can I start first?
Oh,
Dr.
yeah,
Mark will
yes,
be the
yes,
last
sure.
one. Yeah, Dr.
Okay,
Mark will
that's
be the
fine,
last.
Doctor.
All right,
Okay,
thank you. So,
thank you, Doctor.
thank you, thank you, Akil. I think Akil the one who's contacting me since past few weeks. So thank you for having me tonight to be one of the judges. This for tonight we have a very exciting motion about mental health and also medical school. And so for the debate tonight, what I can say is some of the debaters give a sound definition and also interpretation of the motion, and debaters also show convincing knowledge. And also highlighted the important issue that has emerged in the debates. But as we can see, maybe there are a few debaters that has their points jumbled up everywhere. So it's like it's not so organized. So it's hard to convince the judges and the audience as well. And the reasoning given are sound, yet it's a bit loose. Okay. However, I can see your effort there. But then the other thing is for mental health, you need to know that the healthcare professional do use like DSM. I think the full name for it is Diagnostic and Statistical Manual, which they use to guide them to diagnose the mental health disorder. So some of the categories of mental health disorder are like anxiety, bipolar, depressive disorder, feeding and eating pun disorder tau, and then obsessive compulsive as well as personality. Okay. So anyway, you guys have done a good job, put really good effort, even though with a very um, disappoint. The internet is always a problem for us, right? PBL, SJS is always a problem. I don't know how we're gonna cope with this, even though after 2 years of MCO, still like this. So all the best to you guys. All right. So I pass to Dr. Shafika.
Hi, Assalamualaikum. Good evening to all. Can you all hear me?
Yes,
All right.
Doctor, we can hear you.
Okay. First of all, I would like to thank all of you for having me as one of the jury for this event, and I would like to congratulate all of you for this very good program organized. Um, and overall, I would say that the the issue is very interesting, and most of the debaters are well prepared, but some of you all are not that so. Um, and the issues raised up are quite good, but I think most of them still needs more evidence to strengthen the point that you raise up. Okay, and I would say that among all the things that you can put up as a proof of your point, the thing that would be the most convincing to me would be the papers published, because once the paper is published, then it means that whatever that they are highlighting on that issue is acknowledged by all the academicians or all the researchers. So maybe next time you can go on these published papers as your evidence to support whatever points that you are putting up. And then I can see that in terms of the points, the focus is more on the effects on the students while studying, but not much on the effects to the patients when once you are graduated, once the students are graduated from the medical school. One thing that I think we have to remember is that patients are our clients. So at the end of the day, we have to think on the effects on the patients, not to the doctors themselves only. So I think we have to think about this lah, kan? Because after all, it's about treating the patients, not about the individuals or the doctors themselves. And then some of you mentioned about more harm than good, but it's not really clear in what way. I would say that. And then when you talk about competent doctor, it's not just about based on the grades, but it covers so many aspects in order for you to say that the doctor is competent enough in his or her career. And then in terms of the diagnosis of the mental health issue or mental health problem, it's not just about the cost, but also we have to consider about the time taken. If you want to screen everyone, the candidates who are applying for the medical school, of course, we need sufficient time to settle that before the admission of the students into the medical school. So I think these are the points that you can put up to strengthen your points lah. Okay. Other than that, I think all are fine, and congrats again to all of you. Thank you.
Okay, thank you so much to Dr. Norafika. Now we will move on to Dr. Mark. Can you
Thanks.
please comment?
Yes,
Okay.
thanks, Aina. Yes, good evening, everyone. Again, I'd like to echo my congratulations to both teams for even joining this event. This is, I think, this is something that needs congratulations. Well done to both teams. I would like to echo the comments of Dr. Ruzi and Dr. Afika. And I also like to give a couple of points as to, if I was from the government and if I was from the opposition, what else I would have said. And I think the title is quite timely, as some of you will know. We've just concluded the MMI this morning. So, we are looking at new medical students, and we just finished interviewing your future juniors. And so this is something that is quite interesting. So yes, okay. So if I was from the government team, and if I were to say that, students with mental health issues should not be admitted, then I would talk about things such as them being dangerous to patients. I would also talk about perhaps the cost to the healthcare system, i.e., if you have sick doctors, they would then need to take more time off work. It would cost more to the system, more MCs and so on. It would also kind of break the trust of patients if there were untoward incidences that happen. I would give examples of that. I think there are some examples in the papers and in articles. And also perhaps if you may not know this, but doctors actually have a higher rate of successful suicide among all professions, mainly because we know how to kill ourselves. No, actually because we learn medicine and we know what to do, right? So it is dangerous when you have people who have mental health disorders who know what to do to end their own lives. So I mean, these would be some of the points that I would use to support my argument. On the other hand, of course, I think the strongest argument that can be put forward as an opposition would be that this is discrimination. All right. And like what Dr. Ruzi has mentioned, mental health disorders are a wide spectrum. And in fact, there are some remarkable doctors who have mental health disorders, and there are high functioning people in things such as Asperger's, right? Who who may well become good doctors, brilliant in thinking, but may have some difficulty with interpersonal skills. Again, I think there are some movies and series out there on things like that, such as The Good Doctor and things like that, if you've not seen them. And also the fact that doctors are human. So I think it was quite rightly pointed out that even if you screen them, medical students and doctors can still develop these mental health disorders during the course of their study or their future practice. So it would be discrimination to actually bar someone from entering in the first place if it's something that can also develop later on. And at the end of the day, what's important is the safety of the patient. And like what you guys have mentioned, as long as you're compliant to the treatment, as long as you can prove that you can be safe in your duty of treating your patients, then that should not be a barrier. And I think lastly, a point is also that studying medicine and practicing medicine may be different. So we know that there are people who get an MBBS but do not practice medicine. So, if you bar someone from pursuing the course versus practicing, right? And that's why we have the MMC. And when you actually when you do graduate from your MBBS, you actually have to declare your fitness to the MMC in order to get your license to practice. So these are things which can be used as the opposition, I guess. Yeah. So those are my points to add to those which have been debated today, as well as those proposed by Dr. Ruzi and Dr. Afika. But once again, congratulations to both teams.
Okay, thank you so much to Dr. Mark. Now the results are in my hands. The winner of this debate today is the Mars team. So congratulations to the winning team. The best speaker chosen by the juries is Muhammad Iqbal Hakimi bin Lukman from the Mars team also. Congratulations. Okay, so before we end this round, let's all have a photography session, including the juries and the participants. So please turn on your cameras.
So hello everyone, can you hear me? Okay,
Yes,
so
we
I
can
will.
hear.
Okay, thank you. So on my count, okay, everyone, ready? 3, 2, 1. Okay, one more time. Ready? 3, 2, 1. Okay, last one. Ready? 3, 2, 1. Okay, thank you, everyone.
Okay, thank you so much for your cooperation. Finally, it's the end of today's round. Thank you all for the amazing debate today, and thank you to the juries who are willing to spend their time this evening. Hope everyone will have a great evening ahead, and you may leave this MS Teams meeting. Thank you all. Have a great day.
Congratulations, Iqbal. Congratulations, everyone. Thank you. Bye-bye.
All right.
Thank you,
Yes.
Doctor.
Thank you, everyone.